How are you? Toby Kohler back again with Mayo Men's Health Moment. Today we're going to talk about erectile dysfunction treatments, pills, otherwise known as Pde5 inhibitors or phosphodiesterase inhibitors. So what kind of pills can you take to help with problems with erections? Well, it's an interesting backstory. The first pill to be developed for problems with erections was sildenafil. This was developed in the 1980s for chest pain, of all things, to treat angina. And it was developed in England, and the pill actually didn't work that well for chest pain, but when they asked for the patients who were in the trials to send the pills back, lo and behold, they didn't get sent back. Sildenafil was born, otherwise known as Viagra, because patients realized that it was helping with their erections. So in general, this whole class of medications that includes many pills, which you'll see in the next slide, are called Pde5 inhibitors or phosphodiesterase inhibitors. Phosphodiesterase is a chemical that is found throughout the body, which helps regulate blood flow and has many, many functions. And because it's all over the body, you can have side effects throughout the body when you take these type of pills. Keep in mind that no other pills other than the phosphodiesterase inhibitor class has really strong evidence that it helps your penis. So do not waste your money on various late-night commercial ads you'll see for problems with erections. Stick with this class, the Pde5 inhibitors. They work very, very well. It takes a number of trials of these medicines to get them to work properly. Why is that? Well, in previous videos, we've talked about performance anxiety. And when you are nervous about getting an erection, you produce adrenaline. And adrenaline is the most powerful agent to make erections go away. In fact, if you end up going to the emergency room for something called priapism, where the erection won't go away, the first thing a urologist will typically do, or the emergency medicine doctor, is they will directly inject adrenaline into your penis. That almost always makes the erection go away. So no matter what type of approach you use other than a surgery, if you are nervous about getting erections, things won't work well, despite pills or shots, etc. So what happens is guys haven't had sex for a long time. They take these pills, they expect them to work well, and then they take them, they get excited, and they don't work because they're nervous. So I tell all my patients, if you are going to try this class of medications, try them on your own at home first. Do not take them out for intercourse or take it for the first time for partnered sex, because you may be disappointed. When we educate patients properly on taking these pills, we have what's called a lot of salvage success. That is, they say the pills don't work, but then when we re-educate patients how to use them properly, they do end up working. So what are some of the other things you need to know about these pills to work properly, other than you need to try them more than once? I would say you need to try the pills at least 3 to 6 times to really rule out whether or not they're going to be effective for you, or they're not, they're going to fail. The other thing is that of all the men that try pills, only about 2/3 of them will they work. 1/3 of the time the pills don't work. Why is that? Well, the penis is too sick for the pills to actually help. And then of the men in which the pills are effective, they typically last on the range of 3 to 5 years. Over that time period, you don't get immune to the pills, but again, the same thing happens. Your penis gets sicker, and so then the pills aren't strong enough to work effectively. The other thing you need to know about these pills is that your testosterone needs to be in a reasonable range for them to work. So it doesn't need to be extremely high, but it should be greater than 300, which is kind of the gold standard level. And so if you've tried pills and they don't work, and then you replace testosterone if it happens to be low, sometimes we'll have salvage success in those circumstances too. So these pills do need a normal testosterone level to work effectively. Another common question I get is, well, which pill is the best? Which one should I use? It depends. So there's no single Pde5 inhibitor that works, quote unquote, the best. You should pick the pill that you like the best based on cost, side effects, convenience. And a lot of patients try to push the envelope, say, well, the 100 milligram max dose doesn't work. Can I take 200 milligrams? Typically, that does not work, and it just ends up giving you way more side effects. When pills are developed by drug companies, they basically find the sweet spot between efficacy, or how well they work, and side effect profile. So if you push the envelope, typically you don't get much more efficacy, but you get much more side effects. What are the side effects with Pde5 inhibitors? Well, headache, facial flushing, upset stomach, runny nose, back pain, and visual changes. So depending on which drug you try, some drugs cause more of these than the others, and we'll talk about that in a second. In general, you never take these pills in combination with nitroglycerin. Why is that? Well, remember that this drug was originally designed, or at least sildenafil was originally designed, to treat angina or chest pain. How do you treat chest pain? Well, you dilate the blood vessels in the heart. Nitroglycerin does the exact same thing. So if you're taking both a dilator of the heart with nitroglycerin and a dilator of the heart with these Pde5 inhibitors, that creates a really big dilation of the heart, causing an unsafe drop in blood pressure, just like you hear the commercials say all the time. Typically, if you've taken Pde5 inhibitors, you want to tell the person that's coming to get you in the ambulance if you develop chest pain that you've taken these types of drugs, and they will change how they manage things. In general, it's pretty safe. If you start to experience chest pain with any type of activity, the best thing to do is take a full dose aspirin and put it underneath your tongue and let that absorb and call the ambulance. That's the best thing you can do to help save your life. And finally, if you experience very rare problems with these drugs, visual changes that persist, or hearing problems, you want to notify your physician right away. Every once in a while we get some really goofy side effects, and so then you won't want to take these class of drugs anymore. For the most part, though, these are very well tolerated, very safe, and a great therapy for problems with erections. All right, so which one should you personally choose? I've listed a few things based on my experience and some of the literature. You can see the references I used in the bottom corner of the screen. So sildenafil is Viagra. This is the most, probably the most familiar brand that's available. Guess what? That's now available in a generic form. The generic form comes in a 20 milligram dose. So in order to take the full sildenafil dose, you'll need to take 5 of these pills together, right? 5 times 20 is 100. This one is the most common to cause visual changes, or blue dots in the vision. Typically, this gets better relatively quickly, and then you don't have to worry about it. But if visual changes persist over several days, you're going to want to contact your physician. What about tadalafil? This is otherwise known as Cialis, also generic currently. And whenever you have a generic medication, my recommendation is to go to these online websites that are available that can help lead you to the cheapest version of the drug in whichever pharmacy you go to in that town, and so then you can save some money. So look up those websites. But again, tadalafil or Cialis is generic. It comes in 2 standard doses, 5 and 20 milligrams as the max dose. The 20 milligram dose should be taken 2 hours before intended intercourse or longer, whereas all the other 3 drugs that you see listed here, sildenafil, vardenafil, and avanafil, should be taken about an hour before sex on an empty stomach. That's very important. If you ate a big bacon double cheeseburger and you try to take any one of these 3 drugs, it will delay the absorption. It will still work, but it will delay it for 2 hours. So the best thing to do with these pills in general, if you don't want to have to remember anything, is take them on an empty stomach an hour before. Unless you're taking Cialis or tadalafil, you just take it at least 2 hours before, and it doesn't matter what you've eaten. Back to tadalafil, respectively. Tadalafil has the longest half-life. It means that once you take this pill, it will last and be in your system for 1 to 3 days. That is both good and bad. It is good because it lets people be spontaneous and have sex whenever they wish. They don't have to time it perfectly. It is bad in that if you get side effects from this type of medication, those side effects can last longer, right? The other thing that's unique about tadalafil in its daily dose, that's the 5 milligram tablet you take every day, that's been shown to help with urinary symptoms. What type of urinary symptoms? Urinary frequency, urgency, having to get up in the middle of the night. Those type of irritative symptoms, I found this drug to be very effective. And so if you have both problems with urination and problems with erections, tadalafil makes a lot of sense, at least the daily version. Tadalafil has unique side effects in that it can cause back and muscle aches. So if you take these pills and all of a sudden start to develop back pain or muscle aches, you are susceptible to this. It happens maybe in about 5% of patients, and you're probably going to want to switch to a different drug if the pain is too debilitating. This one tends to cause less facial flushing than the rest of these drugs. Vardenafil is not generic, but maybe works a little bit faster in some of the studies. And so that's an option that you can choose. And finally, Evanafil, also one of the newer agents, probably causes less stomach upset and has probably decreased side effect duration. So if you're very sensitive to these drugs, this may be a good choice because you won't get a headache for as long or upset stomach, for example. In general, the side effects, the ones that don't ever get better with time, are facial flushing and upset stomach. That's because these drugs dilate both the blood vessels in the face and the sphincter between your esophagus and stomach, respectively, and that tends not to improve with continued usage. All the other side effects like headache, the other and other side effects, runny nose, they tend to get better the more you take them. If headache is a problem for you, some people choose to take Tylenol with the medication to help address this issue. Okay, so that is a summary of which pills to choose from. Again, it's a personal decision as to which is best for you. I hope you find this information useful. Thanks again for watching. As always, if you have any questions about today's talk, please call the number on the screen, or if you'd like to schedule an appointment, same deal. Till next time, Toby Kohler signing off. Mayo Men's Health Moment, Rochester, Minnesota.